You might want to think about toning your task force meetings down to
Welcome to our weekly update. We appreciate you joining us. We're officially less than 1 week away from daylight savings time, and I'm sure we're all going to enjoy that extra hour of sunshine. Also, we want to share with you that we're doing a lot of resurfacing around the city, from Indian Hills to, I'm going to say finally, doing some resurfacing near the hospital.
Ooh, good.
On 8th Street. We had that set to do actually last year, and then whenever the pandemic came in, we were afraid of doing some resurfacing near the hospital. And
well, thank you.
But start that near the end of the week, or it may. But I saw a lot of sunshine in the forecast, so don't know how well they'll do as far as keeping up with their time. But we'll keep you informed on the areas to avoid over the next few days. So thankful to have Kelly Powers with Decatur Morgan Hospital. Kelly, thank you so much for joining us. And Judy with the Alabama Department of Public Health, Judy Smith, thank you for joining us. Just a short update from me, and then we'll turn it over to them. We currently have 11,577 confirmed cases and another 2,224 probable cases, bringing us to a total of 13,800 cases. Our 14-day percentage positive rate is now at 10.17. You know, I think my wife is in the nursing home business, and I was learning about what it takes to actually have visitors in your nursing home based on CMS guidelines, not necessarily what the governor said. And then is it CMS? Is that right? And does the same thing apply to y'all at the hospital?
It does. Yeah, we have to fall under those guidelines first.
So you have to be under 10% to have those guests to come in, and we were at like 8% last week, and now it looks like we've had a little rise here. Yeah. So I just learned something. Well, Kelly, why don't you give us an update?
Okay, all right. Well, I'm happy, I guess I shouldn't be happy, but I am happy that the numbers are down. They are up and down every week. So we're at 12 positive inpatients, 2 PUIs, 3 patients in the ICU with 1 on the vent. So continuing to see, good positive results from not only social distancing, wearing masks, but also from our vaccines, I think, finally kind of kicking in. So all good. As far as the vaccines, we're still Pfizer, and we've given 8,663 vaccines. Some of those are first doses, and some of them are second total. And then we have, currently we have on hand 4,120, but we have 7,000 people in our queue. So we're still, chugging along, trying to get as many done every day as we can, and we're getting our doses every week, so we're happy about that. So, all good.
Good. Ms. Judy?
Well, Mayor and Kelly, this is our anniversary, and when I say it's our anniversary, it's a good thing and it's a bad thing. March the 13th of last year, we had our first case of COVID in Alabama. March the 25th, we had our first death in Alabama. And up until that time, we felt like we were in shark-infested waters, and the sharks were all around us, and it wasn't going to get us, but it did get us. And we all know well what a traumatic year this has been. And I don't think any of us are going to be upset about getting a divorce from this anniversary. Most divorces are pretty painful, but this one has the potential to be great. That said, cases are down, but they haven't gone away. Positivity is down, although as you mentioned, there is a little bit of an incline in it again, but it hasn't gone away. It's still not okay. And I do want to mention that Morgan County is one of the counties in the state that still has a double-digit positivity rate. It's one of 12. Everybody else is actually under 10. So it's important that we don't give up. Hospitalizations are tremendously down, and that could not be any more wonderful. I do think it's very noble of the mayor to pave the road in front of the hospital now that we don't need it as much, now that not as many people are going, but it is what it is. Vaccine is up, and we'll talk about all of those. I do want to mention that when I say it's not over, and I want to make it clear that it's not over, 61% of the deaths in Morgan County occurred in January and February of this year. And a lot of that had to do with the amount of cases that we had in December. So, you know, we've got to be very cautious that we're not going too fast, we're not getting too far away. I don't know about you all, but I dare say that there's none of us that at some point in our life weren't on a trip, and particularly when we had young children, and the question was always, are we there yet? Are we there yet? Now, my kids said it before we got out of the driveway, but, you know, are we there yet? And, you know, the first few times we were kind, and then after that we weren't quite as kind. We're not there yet. We will get there, but we're getting closer. We're not there yet. We're absolutely not there yet. So please, don't give up what we need to do to protect our community. We don't need to go back in the wrong direction, and we've seen that happen before. Spring break is almost here. There's going to be other things going on. How wonderful that the weather is like it is, and that we can get out and we can do the things that we want to do. But let's don't do it to the point that we put ourselves back to where we were before. Vaccine, well, and I think I mentioned the last time I was here that there are several things that have gotten us to where we are right now. One of those things is the amount of cases we've had. And quite honestly, if you look at the numbers that you just gave, Mayor, what that says is that at least 1 in every 10 people in the population in Morgan County actually was diagnosed with COVID. Now, probably 2 to 3 times that number at least had COVID because they were either a family member that didn't get tested, there was somebody that was hiding out and just didn't want to get tested, or there was somebody that was so asymptomatic or had such mild symptoms that they didn't feel like that they needed to be tested. So quite honestly, we've had a lot of folks that probably have already had COVID. The other thing, as Kelly mentioned, and I could not brag anymore on the partnership in this county for vaccine, you know, is that we now are a little over 2 months into, actually almost 3 months. In another week, we'll be about 3 months into the vaccine program. How absolutely wonderful it has been, even with the struggles that we've had. So many people have been able to get vaccinated. As a matter of fact, I got some data last week. It's preliminary data, and so I don't want it to be the final thing, that 60% of our residents, the folks in this community, 75 and older, have had a vaccine. I'm sure it's probably more since then, because that was the middle of last week. About 40% of those 65 and older have had their vaccine. So we definitely are moving in the right direction. We're doing, you know, what we need to do. More vaccine is coming. We've had Pfizer folks. We've had folks that were using Moderna that have converted to Pfizer, which has freed up some of the Moderna vaccine. More folks are getting Moderna vaccine. As a matter of fact, there's some 700 places in the state that now have the Moderna vaccine. And then now we've got the Johnson & Johnson vaccine, which is rapidly, the state was to get over 40,000 doses, and that was to be distributed to various places across the state. Now, let me just mention, there's actually 2 types of distribution of the vaccine. One of them is the federal distribution, and the good news about that is that they coordinate with folks, and they don't take the allotment out of what the state per se is going to get. Both Kelly and I, the hospital and I, get ours out of the state allotment. But the federal allotment has gone to CVS, to Walgreens, now to Walmart, and it's my understanding that both the Walmart in Decatur and the Walmart in Hartselle either have the vaccine or have it coming. We have several other places that have also gotten the vaccine. Now, many of you probably know that you can get on the Alabama Department of Public Health website, and they've got these little dots that you can go into to find out who actually are providers, who actually has vaccine, and you know, you can call around and see what you want and see what you want to do. I will tell you, in addition to that, and I probably should be ashamed for sharing this, there is another website. It's called Bama Tracker. That is, it's not a public health website, but they take their information from the Department of Public Health, and quite honestly, it is an extremely user-friendly program that we even use. We use it all the time in addition to ours. But if you go into Bama Tracker and you scroll down, you click on a county, Morgan County, and you scroll down, it will tell you who the vaccine providers are in the state. And it has them in a list, which makes it extremely user-friendly. So we're going in the right direction. We have a lot more vaccine. We've got more vaccine coming. We're gonna get to folks as fast as we can. We thank you for trying, most of you for being patient. Some of you weren't terribly patient, but you know, we thank you for being patient. Continue to be patient with us. We're gonna do, none of us, neither the hospital nor the health department nor the other providers are gonna quit until we've gotten the vaccine to the to folks that want it, that need it and want it. To go back to my car analogy, I will say that we're not there yet. We're not there, but we're still on the trip. We're not there yet. And I will tell you, like I tell my children when we begin to pull up to Disney World or wherever we're going, you don't jump out of the car while it's still moving. The car is still moving. Don't jump out of the car just yet. So, but how wonderful to get to come and say positive things and know that we're getting to where we need to be, and hopefully our world and our county is going to open back up a little bit. But thank you for letting me come, Mayor.
Thank you, and we want to make sure that we just continue doing what we've been asked to do as it relates to the guidelines, so we can cross that finish line.
Absolutely. Don't jump out of the car while the car's still
Very
moving.
good.
Right.
Now, my eyesight will not allow me to see what's on your phone. I don't care to see what's on your phone. But while you've been talking and sharing this morning, your phone's been lighting up. Is that just a constant thing for you?
It is. What would I do without a light-up phone?
You receive a lot of requests, don't you?
That's okay. That's all right. That's what we're there for. Whatever it takes to get people the information they need.
Well, know that our community is very thankful for both of y'all and your service.
We're glad to be able to serve, aren't we,
Yes,
Kelly?
we are, very much so.
Thank you. So Madison, with WAFF, do you have any questions?
I do. I have two questions. My first one is there's been a lot of talk that the Johnson & Johnson one-dose vaccine is less effective than the Moderna or Pfizer two-dose vaccine. Judy, I want you to kind of talk to me a little bit about that. Is that true? What is the effectiveness like? Anything and everything you can give me in that regard.
Let me say something. The biggest problem with the Johnson & Johnson vaccine is it was the third horse out of the barn. That is the only problem with it. When it got to the gate, it's still an extremely valuable, it's still a winner, it's still gonna do what we need it to do. It's just that it was the third horse out of the barn. And because it was, a lot of people looked at the other two horses first, the Pfizer and the Moderna. Now, I will also say that it is my belief, I'm sort of struggle with the fact that we didn't have it to start off with, because it is a one-dose vaccine. Had we had the Johnson & Johnson vaccine first, we would have twice as many people vaccinated already as we currently do right now. The other thing that would have happened if the Johnson & Johnson had come out first is people would have said, oh man, we'd had a lot more people vaccinated, things would have been great, and we would have said, okay, we've got Pfizer and we've got Moderna, and it's two-dose vaccines, and people would have said, I'm not taking a second dose of vaccine just to get that more efficacy in there. So it's just a matter of where it's at. It was the third horse out of the barn. It's done everything it seems to be going to do everything we need the winners to do, and that is to prevent serious disease and keep people out of the hospital. And that's where we're going with this to start off with.
Awesome. And then my second question, I think that it could kind of go to all three of you, whoever wants to answer it. Governor Ivey announced last week that past April 9th, they will not be extending the state mask mandate. However, Decatur has their own mask mandate. We don't know what's going to happen with that. I talked to you a little bit about that the other week, Mayor Bowling. With that being said, if Decatur does decide to follow the guidelines of the state, does that worry you guys, considering that we keep saying over and over, we're not there yet, keep going, don't give up? Now, what's going to happen if people aren't required to wear masks anymore? Obviously, the individual business, it's up to them, but I would think that that would cause a little bit of worry for you guys.
So, you want me to answer that?
You go first and we'll follow.
Okay. So, I think that from what I'm hearing, that our city council is going to take this up for discussion over the next couple of weeks. And they'll debate the local ordinance. I missed the press conference the other day but from what I understood, that after the 9th, that the mask ordinance will not be extended.
That's correct.
This is it. And the thing that I guess that I heard that really caught my attention is that Dr. Harris supports that. And I have a lot of faith in Dr. Harris. Now, Madison, whenever we talked last week, I shared that whenever the decision was made by our city council, previous city council, not this city council, but it's the previous, that brought more phone calls to our office than over 10 years. And it was 50-50. 50% of the residents wanted masking, 50% didn't. And that's probably where we'll go this time. But it's a matter of personal responsibility, in my humble opinion. And if you feel like you need to wear a mask, then wear it. To be mandated to do it, it seems like we're easing away from that. But we'll find out what our city council says.
There'll be a lot of information that will come out to see how we do over the next 5 to 6 weeks. And that will play, one of the things we've learned in this pandemic is anything is subject to change. Anything is. And obviously, if we go in the wrong direction, we're going to have to really, even the governor would have to rethink that. But from the get-go, this has been a huge balance of survival and illness. And obviously, those of us in public health and the healthcare arena, we know the impact it has had on people's lives. The mayor knows the impact it has had on businesses, and there were a lot of businesses that had to close down because of their employees being exposed. There were a lot of businesses that had to close down because of their patrons being exposed or coming in with illness. Nobody wants that. Nobody wants to go back in that direction. So, it's a matter of making decisions about what is in the best interest of everybody. I do absolutely agree with the mayor. It is personal responsibility. If you're with your family and you're outdoors and you're adequately spaced, probably it's going to be a easy peasy decision. But if you're not, if you're in close contact, there's a lot going on, then you need to really think about it. I will tell you, the Department of Public Health has already made the decision because we are in daily contact with people that want to be tested, that want to be vaccinated. We will continue to wear our mask. I also reported to them last week, I had just had some more cute monogram ones done, and it would be a shame not to get to wear them. That's not the good reason. But, the mayor is correct. Personal responsibility. We have learned so much in this past year about protecting ourselves. Look at flu that's down. We have had the lowest flu year we've ever had. We've also learned that we can do without a lot of things. I don't have to shop every day. Now, it grieved me for a while, but I don't have to shop every day. But look at the things we've learned. Let's learn our lessons, just like we teach our children. Let's learn our lessons. If we got burnt on the fire, let's don't touch the fire again and get burnt again. So I agree with you absolutely, Mayor.
And I agree. I think the same thing is it's just common sense. If you're around someone who's immunocompromised, make sure you do the right thing and wear your mask and protect people. We don't have an ordinance that says for us not to walk across the street when a car's coming down the road, because we know better. So I think we just use that same common sense to say, hey, when do I need to wear my mask and when do I not? I've been vaccinated, but I still wear my mask because I just don't want to chance me giving it to somebody else. So, all in all, it's just personal responsibility.
Anything else, Madison?
I think I'm good.
Okay.
Thank you, guys.
And Amy, do you have anything?
Yes, we have Lauren Harkson from Channel 19.
Okay.
Lauren, are you with us?
Yeah, hey, I'm here.
Okay, proceed with your questions.
All right, so I know we've talked a little bit about the Johnson & Johnson vaccine and how Alabama's received around 40,000 doses, but do we have any idea when those doses will actually be distributed in Morgan County specifically?
They're working on the distribution of that Johnson & Johnson vaccine right now. And again, they're making some decisions about which providers to send that to. Now, I will tell you, the goal is that those that have Moderna will continue to have Moderna. Those that have Pfizer will continue to have Pfizer. And the other thing is we're trying not to duplicate because there's too much margin for error. Some of them are 1 dose, some of them are 2 dose, some of them you get the second dose at 3 weeks. So what they're really looking at is the providers that are willing to take it, where is the best utilization of it, and you know, there's going to be a lot of places that only getting 1 dose is probably going to be extremely valuable. Perhaps in our homeless population, perhaps in our others. I do know that there is some discussion with CVS about getting the Johnson & Johnson vaccine, but I think those distributions are being determined right now.
Okay, thank you very much.
Certainly.
And does it seem like we're getting closer to possibly moving to the next phase of vaccines, 1C?
Every day we're getting closer, every day. And, you know, I do think it won't be long. Like I said a little bit ago, we now know that in Morgan County, some 60, probably 65% of the 75 and older, and everybody doesn't want the vaccine, you know, but have gotten the vaccine. You know, we're also seeing every day progress in the 65 and above. So I do believe that the other groups will be open soon. You know, and I guess we all have a personal thought as to where that needs to be. My heart is a little bit into if you have pre-existing health conditions. I mean, that's just a personal heart thing for me, and I've even struggled with it right now. So I'm hoping that's the direction we will go in. I guess the problem you get into with that is it's a declaration thing, and who doesn't have another pre-existing health condition? So, you know. But I think we're moving there rapidly. Just hang on, and I think that has a lot to do with the mask ordinance.
Perfect. Thank you so much. And then this is for the mayor. What is your reaction to the social media posts circling from Hunter Pepper and thoughts on Billy Jackson calling for his resignation?
I really don't have any thoughts on that. That's a question for Mr. Pepper. I regret that happened.
Okay, thank you.
Sure. So in conclusion, this time last year, we were taking steps and actions to quarantine. Now we're talking about vaccine distribution. Today, let's be grateful for the strength that we've had in the past year and all that our healthcare professionals have taken to keep us safe and healthy. This marathon isn't quite over yet. Let's stay the course and be kind. Gosh, I'll never forget Dr. Boyle sharing that, talking about the importance of being kind. So with that, we will see you. Look, we're going to change things. We took a vote before I got here. And instead of doing updates on a weekly basis every Monday, we're going to go to every other Monday. So we'll join you on Monday week, March the 22nd at 10 o'clock. And until then, take care. Thank y'all.
Thank you.
You're so very welcome.